Day, it's hump day. I am going live because I'm trying to do that more often to connect with people. I'm looking to connect with leadership staff of health focused organizations and businesses who are developing, implementing, evaluating public health related programs like health education programs such as diabetes prevention, diabetes self management, injury prevention, like poison prevention, choking prevention, safe driving. A foundation I've supported in the past is drowsy driving. All those types of staff and leadership who are overseeing these organizations, these initiatives happening at organizations across the United States. So let me close my door really quickly. Hold on. My husband just came home, so I don't think he knows I'm live. Um, but if you are staff or leadership of those types of organizations, I want to connect with you. And right now, I'm just going to be on live doing some work, but also answering questions and talking about community health workers versus certified health education specialists. I am so passionate about public health and healthcare and the intersection between the two. I like to say that healthcare and public health are like cousins. We are not the same. We're related, but we're not the same. But there's also some essential things to know about the difference between community health workers and certified health education specialists. And so I'm Brittany Jenkins. I'm the founder and CEO at Jenkins Public Health Consulting. I'm also a certified health education specialist, which I'll touch on the difference between that in just a moment. But if you have any questions or anything about what you're doing in the industry, even workforce development needs, don't hesitate to drop them in the chat or even connect with me later. I can answer your questions and actually align you with some resources that could be beneficial to where you are right now. If you are the leader of a health organization or a staff of a health organization and you're like, hey, we need more funding, we need to identify why we have low participation rates in our program, our marketing isn't really working out very well, our community connection needs to be improved, don't hesitate to reach out. That is what I do. We have a 5-step community impact framework that has helped organizations strengthen their existing efforts, identify funding opportunities that has blown their mind, really, and then also build trust with community. The healthcare industry has a bad rap, from historical issues and systems that has not allowed certain people to get access to resources. And so my goal as the CEO of Jenkins Public Health Consulting is to help organizations rebuild the trust and rapport between the organization and the community, because that's so needed. No matter if you are someone who has a more holistic approach to healthcare needs and resources, it's still good to know what's available in your community. It's still good to know that there are, medical professionals who have the best interest of the people. And I'm one of those people, right? I'm a non-medical practitioner, so I don't give medicines or surgeries or anything like that, but I do provide health education and I do support health organizations to make sure that people really have access to their resources and actually have an improvement of health or quality of life. And so literally been doing that work for about 15 years plus. If we're talking about what I was doing growing up in communities, really working towards community change, I've been doing that from a very young age. My grandparents, they really inspired me to pursue a career in healthcare. I was actually going to be a pediatric surgeon. Thank you guys for tuning in. But I was actually going to be a pediatric surgeon, and I worked in hospitals and rehabilitation centers where patients were actually injured because of things that happened in their life. And I was like, I don't want to be a part of the cure. I want to be a part of the prevention. Thank you so much. And, to be honest, I'm going to miss people who are in the comments because I noticed YouTube is a little bit more cutthroat. But if you have any questions about anything related to jobs in healthcare or public health, anything related to like negotiating your salary, also if you are working at a health focused organization, I want to invite you to my upcoming training on April 9th. It's going to be good, y'all. My trainings are really interactive. People actually enjoy the trainings because we don't just talk at people, we actually get people engaged and conversing, and really taking some things away to put into action immediately. So even if you're curious, come there. It's free. It's at Jenkins Public Health. Well, it's jenkinsphc.com. So if you're even interested and you just want to be in the room to be an onlooker, come see me, come meet me online, and I'll really engage with you. Um, and so thank you for subscribing. We are trying to get our subscriptions up. So if you would like to see more of me on your timeline on YouTube, don't hesitate to subscribe. If you have any content ideas, let me know. We're still growing our channel to make sure that we're providing content that is of interest of the people. But thank you so much. You said that you're not an adult yet, but you want to be a pediatrician. That is good. That is good. You know what helped me? Because I think I started to pursue healthcare around the age of like 12 years old. And I remember that because my grandparents actually adopted us and we, were under their care. And so I actually used to volunteer at the hospital and job shadow at the hospital to get more experience. And it was with a pediatrician. So there are opportunities for you to actually volunteer and job shadow inside the hospital right now or in clinical areas. They typically still, I remember they still made me go through HIPAA training, but since I was a volunteer and job shadowing, there was not an age limit. So I could go in there pretty young and job shadow. So don't hesitate. Don't think that you're too young to start getting experience. All of that counts. And you kind of helps you clarify your career journey as soon as possible. A lot of the work that I'm doing to help people clarify their career journey is encouraging them to go ahead and start figuring out who you know in your community or with your contacts or your family members who are in the industry, and go ahead and say, hey, like, this is what I'm interested in. Can I job shadow you? And their organization might have a process in place that will let you come in and job shadow. So it's really, really good. Hello, thank you for being here. Someone else said that they want to be a doctor when you grow up. Yes, pursue it. We do need doctors. I'm more of a holistic approach to healthcare, but I still use the hospital now. I know where I need to go if something serious is happening. But we need doctors. We need pharmacists. We need pediatricians. We need OBGYNs. We need all of those people to make sure that people are getting access to care. I'll tell you this. I'm working with an organization. They are pharmacies. They're a pharmacy. And, the historical nature of pharmacies isn't always positive, but they are for the people. They are really making sure that patients are not experiencing unnecessary medical visit, unnecessary hospital admissions. Okay, so they're making sure that these patients have the education that they need to ensure that their health is good so they don't have to visit the hospital unnecessarily. They don't have to get all these medical bills because they had to go see their doctor for a question that could be answered through, by their pharmacist. So they're doing so many things to help people lose weight, take care of their health, understand what their A1C levels are because they're type 2 diabetics. Be careful with over medicating themselves because sometimes people forget to take their medication, so they might double dose on that, and that can lead to a poison emergency. And so they're helping to reduce that. So there's so many good benefits of different industries who are actually doing the good for the people. And I do truly believe that most doctors are doing things for the best of the people. But again, we have to continue to fight against that. OBGYN. Awesome. That is awesome. So yes, I'm curious too. The work that I'm doing in the state of Alabama, where I'm located, they don't really certify community health workers. They only provide certificates. And that's really important if you're pursuing a career in healthcare or public health to kind of know the difference between community health workers and certified health education specialists. If you're going to school, at minimum, you would need a bachelor's degree in science, public health, biology, etc., to become a certified health education specialist. Now, certified health education specialists are individuals with that minimum degree and who also have experience or the knowledge to be able to design health programs, implement them at the community level, and also even identify funding opportunities to ensure that they're sustainable. And so I know like that can be a very deep topic to talk about right now, but if you're literally pursuing a career in healthcare or public health, that is an opportunity for you to be able to negotiate your salary, right? Negotiate your offer letter and get paid more on top of like what you're trying to do within your role, right? I only have a bachelor's degree in public health. And, contrary to popular belief, you don't need all these degrees and certifications to be successful. I used to be a director at a medical center, right? And it's because I started very young. job shadowing and interning in the healthcare industry to know exactly what I want to do, to have an insider view of what's happening inside the healthcare scene, right? It's different to be a patient, but it's also different to actually navigate the healthcare system as someone who works for the organization. And so I had insights that were essential for me to know and gain that allowed me to be successful and work in a director level position for a medical center. So yeah, I'm just reading this comment that's left here. I'm not a teacher. Technically, I am a teacher. So like health organizations hire me to train their staff. And so I'm training their staff on like how to build trust with communities, how to make sure that your programs are easy to access for the community, no matter what their need is, right? Do they have a transportation need? Do they have a literacy need? Do they understand what resource is available? Are they actually getting connected to the resource that they need? Because a lot of the times these organizations are doing things for community outreach. Hey, here's our diabetes self-management program, but you're just giving me a flyer. You're not making sure I get access to this resource, right? So I help organizations actually make sure that people get access to the resource that they offer. Because if organizations don't get people in these programs, they're not going to be funded. Literally, I used to be a grant writer and also, a grant reviewer for state related grants. And I'm telling you, organizations were losing like $50,000 within one year because they were not, they didn't have participation in their programs. They were not building connections with stakeholders of that community that they were serving. But then I've also helped organizations secure like multi six figures in funding opportunities within 1 year. And so I know exactly what to look for, when it comes to writing grants, everything, there's no guarantees, but when you know what to look for and how to position yourself to win the grant, you will never have, well, I can't say never, but you will always be able to find funding opportunities. So not technically a teacher, but I do train staff of health organizations. I'm just reading this comment. Yeah, being discharged when you're not ready is that's always complicated because then you have like insurance companies who are not going to cover the person if they're up to a certain amount of time. So like full transparency, I have a little girl, she's 3 years old, but I had a C-section when she was born. And I knew that the hospital, my insurance was only going to cover us up to a certain amount of days, and then they could like technically like kick me out of the hospital. So it's important on the patient side to know what insurance covers and doesn't cover, but also advocate for yourself because if you're definitely experiencing a serious medical emergency, like technically, I don't think they can just kick you out. But I don't think discomfort is a reason why that you would stay either. But, always advocate for yourself. And I hope that your family member is getting the support that they need post hospital visit. So, yeah. One of the things I'm also working on right now is I'm creating a graphic for an organization. And you might have seen some of my other videos. I think I posted about like Canva and some of the graphic design tools I use. I might have put it on Instagram, I'm not sure. But I'm just working live right now. If you guys have any questions about workforce development, job placement, salary negotiation, don't hesitate to let me know. Like I said, I have been live a few times and I didn't really answer questions from the chat. And so I kind of want to do better with that this time around. And so if you have questions, don't hesitate to let me know. Let's see here. You can also follow me on Instagram. It's Jenkins_public health. And then I'm on LinkedIn. So if you guys are, current or aspiring public health or healthcare professionals, you need to be on LinkedIn. If you're not on LinkedIn, you're missing out on like a lot of opportunities for your life and your career. And I mean that wholeheartedly. LinkedIn does not pay me to say that. I think it's an essential element to career success. Simply because that platform is only utilized for those who are professionals, right? It's nothing compared to Instagram. Other than it being another social media platform. But there's a lot of intention behind the use of LinkedIn if you go on there with intention to, find a job, make connections from all over the world, learn about your industry in depth, understand kind of some of the pay opportunities among different job industries, etc. So I love LinkedIn. Um, a huge advocate for that. So I'm on YouTube. If you haven't subscribed to our page, please do. I thank you so much. That would be so helpful. Oh, I'm so sorry. God, there's nothing like losing a grandparent, man. I lost my grandfather when I was in 6th grade. I'm not going to tell you how old I am, but that's still like, it's still sad, so I don't know, I don't take grief very well, or the loss of family very well at all. So yeah, I can only feel for you. But be an advocate. There are coalitions that need someone like you to advocate for patient care, quality care of patients. And sometimes it's like, hey, we can't do anything else to treat you, but we can still show you a level of respect when it comes to discharge, right? Whether that's further explaining the reason, whether that's connecting them to a resource. But that's kind of what I talk about to organizations who are providing care to patients, whether it's like cancer centers, injury prevention programs, whoever it is. I provide training about empathy, having empathy, and addressing their biases, because that actually changes the way that health professionals treat patients. I'm not saying all, but we all have biases for sure. And not that we all act on these biases, but we all do have biases, because there's 170 of them that exist. And one that I like to share is like beauty bias, right? Like for an interview, someone might think that, I'll just talk about myself, like I look like I have it all together today. So they're like, oh, she's pretty, I'm going to hire her. That's bias. That's a beauty bias. But in reality, this person might not have it together. They might not have been the best candidate for that position, because you're only looking at one part of this person and making a judgment, a blind judgment about this person. So there are literally 170 biases that exist. But when it comes to building a relationship with the community, understanding what their needs are, explaining things, because 9 out of 10 adults are not health literate, meaning they have a challenge with understanding their care plan after a doctor explains it. They are having challenges with reading medication labels, even after a pharmacist goes through it with them. There's a lot more medication errors unintentionally, and even intentionally, but we're talking about unintentional medication errors. There are so many things that happen because people don't understand health from a literacy standpoint. And that's why, health professionals should take a little bit more time to explain things, even though they have a lot on their plate. But I don't think that's an excuse. So yeah, yeah. Let me see. I saw a couple things. Easy 24, you're funny. Okay, take it easy, easy 24. um, but yeah, thank you guys. If you haven't subscribed to our YouTube, please do. We're trying to get to 1,000 subscribers by July 1st. That's just a soft date. I also have a free community impact training coming up on April 9th at 12 p.m. Central Time. It's for any current or aspiring health professionals who are designing, implementing, evaluating health programs and initiatives. It's really showing, talking to organizations about building relationships with communities, and some of the best practices on how to approach communities who might have resource needs. I know that I used to work for government agencies in the past, and now I run my own company. And, I just recall the way that we used to approach communities and how it was offensive to people, even in the smallest things. I remember I put a flyer up at a gas station that belonged to, one lady who really felt strongly about placing flyers in that neighborhood. And I mean, I got chewed out for weeks. And I was like, we're here just to put flyers up about this community health initiative. And I mean, she did not like that. But that's the part of community health and relationship building that we need to know about if we're trying to do something good for our community. You can't just walk into neighborhoods and start doing stuff without speaking to those stakeholders, those gatekeepers, those community, those neighborhood associations, to let them know who you are and why you're here, and that you're not here to take, but to provide, anything that they need to improve their health or quality of life, etc. So yeah, I had some very, very interesting experiences working on the ground in communities, good and bad. So yeah, some very funny things people used to say to me as well, when it came to their health. So yes, yes. I'm gonna just be doing this on the side. If I see any comments pop up, about workforce development or being a health professional, working in the industry, I will address it. But I am working on a graphic design right now for an ebook for one of my clients. And yeah, that's part of our framework. We really make sure that organizations are creating graphic designs and educational material that are easy to understand and also grabs the reader's attention. It's pretty much part of our community impact framework, to make sure that we're reaching, engaging, and serving our community members and helping to achieve the outcome that we said, right? If we're planning to help them reduce, let's say if we're planning to help them manage their diabetes more effectively, then we need to follow through with that commitment, whatever it looks like. And that's within our service type, right? So that's some of the things that we really make sure, and that helps to keep the organization open. It builds relationships with the community. They feel better. They live longer. It costs us as taxpayers less money when people are healthier, actually. So that's why everybody should be a part of that. I think I touched on it briefly a little bit, but coalition building is huge. Um, if you want to volunteer for something good for the people, good for your community, join a coalition or create your own and kind of start seeing like what that entails. It's different from, an association. It's different from just volunteering for a nonprofit organization. A coalition actually is looking to change policies, change systems, dispense resources for people, and advocate for change. Like when people don't think their vote matters, it actually does. It actually does. And that's when I learned, because I used to be a part of a coalition. And I still am a part of coalitions, but in a different capacity. So yeah, join a coalition. Let's see. We will be putting up some more content that's scheduled to post, about workforce development topics. That's also a part of the services that I provide, at Jenkins Public Health Consulting. We help to place people in mid and senior level jobs, in healthcare and public health. Interestingly enough, we've been doing that since 2018, and people often think, oh, I need like 10 years of experience to land a manager or a director level job. No, you don't. Really, it's really getting some experience, whether it's volunteer, your fellowship, your internship, or even having work experience. That's all wonderful. You don't need all these degrees and certifications, but what you do need is confidence. What you do need is to prepare, and also knowing how to frame what you're saying about your experience in a way that convinces the hiring team that you are the ideal candidate for that role. I literally, like I said before, I'm not sure how many have been following since I said this, but I landed a director level role for a medical center with only a bachelor's degree and was able to secure a 50% raise in my salary. Most people think that you need a PhD to do something like that. Like literally, most people think that. And so if it's possible for me, I know it's possible for you. Seriously. So it's really getting connected with the proper mentorship, to make sure that their limiting beliefs isn't limiting your opportunities, because proper mentorship is essential to also be successful in your life and your career. So I am going to be logging off in a minute so that I can finish up some of this graphic design, but I want to make sure I'm not leaving anybody just talking in the chat like I did before. But it's been a pleasure. If you haven't subscribed to our channel, please do. If you are looking to attend our free community impact training on April 9th, please join us there. You can go to Jenkins, JENKINS, PHC, the acronym for publichealthconsulting.com, and you can register for free, easy, and we hope to see you there. So yes, follow us on Instagram as well at Jenkins_PhD. And if you have any content requests for me to upload on YouTube, don't hesitate to let me know, and I'll get that created for you guys. We're always doing something. We have some good stuff that's being uploaded in the next few hours, actually. So I hope to connect with you further. Thank you for your time.